Hi, this is Elliott Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite ends of the country today to talk about Medicare
We're asking,
and answering all your questions related to Medicare so that way you can make an informed decision. This is the Medicare Navigators Podcast.
People missing Medigap Open Enrollment. First of all, what is Medigap and what is Medigap Open Enrollment and how can we not miss it?
Yeah, so what Medigap plans are, another name for them are the Medicare Supplements. I always just refer to them as Medicare Supplements, but a lot of people refer to them as Medigap plans. They're basically the plans that fill in all the out-of-pocket gaps in Medicare. So Medicare is set up by the federal Medicare program, right, A and B. But since Medicare doesn't pay for everything, Medicare has had to team up with the private sector, the insurance companies, so that insurance companies can come in to offer these plans to help offset those out-of-pocket expenses. So it's kind of like a public-private partnership where Medicare is going to pay most, but people can go out and get separate extra insurance, supplemental insurance or Medigap insurance to help pay for the out-of-pocket expenses that Medicare has. So that's really important to add on some sort of extra supplemental plan to go with your Medicare. And Medicare would pay first, and then your supplement pays second. The open enrollment for Medicare supplements, there's a couple windows where you have a guarantee to purchase a Medigap plan or Medicare supplement as a guarantee. No questions asked, no pre-existing conditions. Usually that's either within 6 months of your 65th birthday. So what would happen is if you delay Part B of Medicare till later, when you activate your Part B, you would have an additional 6 months from that point to purchase a Medicare supplement. So there's different situations, open enrollment or guarantee issue periods of time where you can purchase a Medicare supplement, no questions asked. So it's we suggest as soon as you're relying on Medicare as primary and your Medicare is set to go into effect, have that Medicare supplement or Medigap plan take effect the same month. Okay, so if we're switching over to Medicare for April 1st, have your Medicare supplement start April 1st as well, just to make sure you're all covered starting April 1st.
Okay. And then is there a penalty if you miss that? Or is there what happens if you miss that your personal period of time where you can get that guaranteed issue plan?
Yeah, so what happens there is if you miss that 6-month window, you probably will have to go through medical underwriting to qualify for a Medicare supplement plan. So they may have to go through we would have to go through medical questions, and then the insurance company would pull your medical records as well, and maybe even check with some of your doctors to get some information on you. And if there's any pre-existing conditions that are automatic disqualifications, you could get denied coverage. It depends on the state. Here in California, it's pretty much a black and white. If you're approved, you're approved. And if you're not, you're not. In other states, some of the carriers may say, okay, we'll accept you on your Medicare supplement, but because of this pre-existing condition, we're going to have to charge you a higher amount. Here's the amount that we're going to charge you. If you want to take it or leave it. That's our offer. So it depends on the state. Sometimes you can get approved, but at a higher premium, or maybe you're healthy, clean history, you can get accepted at the preferred premium. But we always try and work with folks within their open enrollment or guarantee issue period for Medicare supplements.
Okay, gotcha. So it's not like the Part B late enrollment penalty where they just up your fee. It's more like you may not get the coverage that you want because you have to go through that medical underwriting.
Yep.
Oh,
yep.
Gotcha. Okay.
Yeah.
That makes total sense. And then do you know, or can you explain to us about the Part D late enrollment penalty? Is that a thing?
Yeah, Part D has D as in Delta. That also has a potential penalty. So those are the two potential penalties out there on Medicare: is Part B as in Bravo and D as in Delta. The Part D penalty is for prescriptions. So what happens is when you're new to Medicare, you need to get a prescription drug plan. You don't have to, But if you don't, you'll be accruing a penalty. The penalty is it's 1% for every month you go without a prescription plan times the national average cost of a prescription plan. So if you go 12 months without a prescription plan, it's 12% of, I think the average right now is like 35, maybe $35. Don't quote me on that, but it's somewhere in the $30 range. So 35% or 12% of 35 would be a penalty of $4.20, let's say, monthly. That penalty never goes away. So that individual, if they eventually pick up a prescription plan, they would get assessed a $4.20 a month penalty that will never go away for as long as they're on a prescription drug plan through Medicare. So the way to avoid that, if you're covered through an employer group plan, you want to make sure that your employer group plan meets a standard called credible coverage, credible prescription coverage. Basically, what Medicare wants to make sure of is that the prescription coverage you have through your employer is either as good or better than you can find on Medicare. Okay, and it's a standard. It's the employer group plans have to send out notices of credible coverage each year. Okay, so as long as your plan meets that standard, and most employer group plans do meet that standard, but definitely it would make sense to double check, make sure you have, you can even get a notice of credible coverage letter that from your employer plan. If you have credible coverage, you can delay Part D as in Delta of Medicare. As long as you're covered through that plan, you can delay Part D of Medicare for that period of time. And then when you need to switch to Medicare, then you just pick up a prescription drug plan at that point.
Okay, got it. That makes total sense. Okay. So the two penalties, just to review, that you can have on Medicare is the Part B late enrollment penalty, Part B as in Bravo.
Yep.
And then Part D as in Delta, 1% for every month that you're not on a prescription plan times the national average of a prescription plan. Okay.
Nice and simple calculation, right? Very simple.
Yeah.
I don't know how they come up with these.
So don't you just love the federal government and how they just make everything so crystal clear?
Yeah.
So another thing I wanted to ask you about is my friend Marie. She moved from Oklahoma to North Carolina.
Yep.
And she was on an Advantage plan.
Okay.
They got here and she had a cardiologist appointment. Went to her cardiologist appointment here in North Carolina, found out that they did not accept her Advantage plan. So explain that to me. What happened there? How can we avoid that from happening?
So if somebody's on an Advantage plan, it depends. Did your friend move from Oklahoma to North Carolina?
Yeah, she moved from Oklahoma to North Carolina and she didn't switch anything with her Advantage plan. Okay,
so that could be an issue where she could get dropped from her Medicare Advantage plan in Oklahoma. So that could be the issue where her current plan found out, hey, you moved out of state. This plan is for only residents of Oklahoma. So once you move, if you're an Advantage plans are regionally set. So if you purchased an Advantage plan in Oklahoma in your county, or there might be a collection of counties within your area where you can purchase this type of Medicare Advantage plan, once you move to a new state, that's definitely out of your service area. You would have to purchase a new Advantage plan in the new state within 60 days of your move.
60 days. Okay.
Yeah. So 60 days, and you can get a new plan and have no lapse and do that. So that would be one thing, is if your current plan found out you moved, they'll just drop you.
Will they tell you?
They'll notify you, but whether or not you get the notice since you've moved, I don't know if you'll get wind of that. You might not find out until you go to the doctor and realize, hey, my insurance company canceled my insurance. Okay, because if you notify Social Security will notify your Medicare Advantage plan. They notify Medicare and Social Security, or obviously if you let Social Security know, they'll let Medicare know. Medicare gets notified of the move and lets your carrier know, your Medicare Advantage carrier know, hey, this person's now living over here. you can drop them, or, or the insurance company will drop them. And so that could be the case. Sometimes people have Medicare Advantage plans, maybe they haven't moved, they're just visiting friends or family, or maybe they spend half the year in another state. Depends on the Medicare Advantage plan. If it's a PPO, you might be able to access doctors in other states. That might not be an issue. But if it's an HMO, then really you only have emergency care in other states. Okay. So it kind of depends on what happened to your friend, whether they got dropped, or maybe they were in an HMO in Oklahoma and tried to go see a doctor in North Carolina. That's not going to work unless it's an emergency.
Okay.
And really, since they moved, they should technically pick up a new plan in North Carolina.
Okay. I think
Yeah.
they got dropped. I think
They
that's
got
what
dropped.
happened,
Yeah.
because it was a regional plan, but she didn't understand that because I think she didn't get that notice in time
Yeah.
before she had to go to the doctor.
Yeah.
And so it was a rude awakening when she did go to the doctor and she realized, oh gosh, I don't have my
insurance
coverage anymore.
Yeah. And if you don't pick up something new within 60 days, yeah.
So what about people that are snowbirds? They live maybe, I'm just going to choose the most extreme example. They live in Minnesota for the summer and they live in Florida for the winter. Is it even possible to have an Advantage plan if you're someone like that, or do you have to stick with original Medicare?
I think it is possible to have Advantage. I think there's some sort of rule on the Advantage plans. You can't be living in another place and don't quote me on this one again, but I want to say it's 6 months.
Okay.
So I think your main residence needs to be in that particular state you purchased the insurance. And then if it's you would want to make sure it's a PPO. That would at least give you the best opportunity on Medicare Advantage to go see other routine doctors in another state. But I usually suggest traditional Medicare for those folks if they can afford it. Just because traditional Medicare, original Medicare works in all 50 states, totally transportable across state lines, basically like you're in network wherever you go within the 50 states. So that's the most effective way to get access to doctors if you are living in 2 different states throughout the year.
Okay. Because I do know a lot of people do that. And
Yeah.
so
yeah.
I was just curious how that
Very common.
works.
Yeah.
And we've talked about this before, but can you kind of explain to people, according to you, what is the Cadillac of healthcare during retirement? Like, what do you guys suggest?
Yeah. Oh yeah, that's easy. So and this comes from my dad. My dad calls this the Cadillac of healthcare, is having traditional Medicare with a Medicare supplement like a Plan G, and the reason it's a Cadillac is it gives you nationwide access to any doctor, any specialist, any hospital that accepts Medicare. And that includes probably 99% of hospitals. I think the stats maybe low 90s% of doctors except throughout the country accept Medicare. I mean, some professions like psychologists, it's more of a 50-50 shot, but your major medical providers, probably in the range of over 90% contract and accept Medicare. And you don't need any referrals. So if you want to go seek out a specialist, you don't need to get permission from a primary care doctor. And the great thing about Medicare is there's no network restrictions. You don't have to worry about in versus out of network cost differences. Just any participating provider that accepts Medicare. And then when you add on that supplement, that eliminates almost all your out-of-pocket exposure. And at age 65, it's roughly $300 a month on average altogether. And of course, that depends on income. You could pay more for Part B based on income, or maybe in your state, the Medicare supplements are more expensive. Washington state, it's like $200 a month for a Plan G, whereas California is more like $130 at 65. At age 65, New York is probably $250 to $300. Arizona might be $150 average. So it depends on where you live, but let's say roughly $300 a month. At age 65, you get nationwide access, hardly any out-of-pocket exposure. So that's why we call that the Cadillac healthcare.
And your grandmother had that, and she was in the hospital for over 100 days.
Yep.
And she paid zero out of pocket, right?
Right. Yeah. She was in for pneumonia, was in for about 30 days. My dad went to go pick her up at Hoag Hospital, and she was completely out of breath. And turned out she was having congestive heart failure that day. So she had roughly 110-day stay at Hoag Hospital, and she ended up coming home and living with us. And she had everything available to her during her hospital stay. Luckily, she had Medicare and a Medicare supplement. She paid zero out of pocket for that hospital stay. It was 100% covered between Medicare and her Medicare supplement. So that is more reason. And this podcast is not brought to you by Cadillac. We're not paid by Cadillac, but that's why we call it that's why we refer to it as the Cadillac of healthcare. It's just such good access, freedom of choice. And on top of that, it's peace of mind for your loved ones too. So,
yes,
yeah,
exactly. I don't even know if Cadillac is like the best or the coolest
right.
car anymore, but
Yeah,
people know what you mean when you say that. So
right. Yeah, it's just one of those terms. Yeah.
yeah, exactly. Um, so this is kind of the last thing I wanted to ask you about. So let me see. This was back in 2015. My husband and I took a trip to Thailand,
Mm-hmm.
and it was very expensive to get there. But
Mhm.
once we got there, we were just shocked at the cost of living and
Yeah.
how affordable it was to vacation there. Like once you get there, food was like less than $1 for a meal. It was like hotels, really nice hotels were incredibly affordable. It would be like
Yeah.
staying at a motel here. You got to stay in this like nice resort. Transportation was affordable. Everything was super affordable.
Yeah.
And so we've kind of joked, kind of half seriously, half not. Someday when we are in our golden years, let's retire in Thailand.
Yeah.
And
Move to Thailand.
yeah, we saw a lot of retirees there that had done that, who from the UK, some from the US that had decided that they were going to take their nest egg that they had saved up and live in a place like Thailand.
Live in luxury.
Live in luxury with just kind of a normal nest egg.
Yeah.
And so I've thought about that, and that always kind of seemed like a dream. Like, why wouldn't everyone do that? But then there's the whole issue of healthcare.
Right. Yeah.
And so if someone were to come to you and say, this is my plan, I want to go retire overseas. What about healthcare? What would you tell them?
Yeah, it's very tricky. And I have gotten, actually somebody reached out to me once. They were living in the Philippines. I think the Philippines is a big retirement spot as well. And there's just a lot, US and Philippines have a lot of relations. So it's a very easy place to retire, it sounds like, for a lot of individuals. But what happens is once you leave the United States, your Medicare card itself does not come with you. Or, I mean, you obviously can bring it with you, but it doesn't work outside of the United States. Mm-hmm. So people have to decide whether to keep Medicare and pay for it or to disenroll from Part B and accrue a penalty. Okay. And then if you, I mean, so yeah, I guess it depends if you want to keep that option open where you could come back to the United States. If you need a medical procedure and you just don't feel comfortable getting that procedure done in another country, or there's no specialist in that country to help you out and you need to come back, you know of a specialist at UCLA that works on this specific illness, you may want to keep your Medicare active, right? But then you got to pay for it. Pay for something that you're really not using while you're overseas. Or you can disenroll and accrue a penalty, and then you've got it when you come back, you would have to apply for Medicare during the general enrollment, January through March. So if you come back April 1st and you need Medicare to kick in, well, guess what? You've got to wait another 9 months or so to activate your Part B because you don't have good reason to reactivate it mid-year. So that's it's really a difficult call.
Thank you so much for joining us for another episode of the Medicare Navigators podcast. We have a weekly Medicare 101 webinar that we would love to have you join us on. Go to our website at www.martinmedicare.com to reserve your spot today. Please join us again next week as we continue this conversation. All information related to this episode is listed below in the show notes.